Hi, I'm Emily Haynes, Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. Thank you for joining us today. We're teaming up with Families Fighting Flu to raise awareness of the importance of maternal vaccinations for whooping cough and flu during pregnancy. Whooping cough is a very contagious respiratory disease caused by bacteria that is spread from person to person that can be very serious for young infants, especially under 2 months old. Flu is a respiratory virus that can be very serious for people of all ages, and especially for young infants under age 6 months. Our campaign, 2 Protects 2, aims to elevate the voices of families and physicians to promote vaccination during pregnancy. I have a great panel here with me today, and I'd like to start by introducing them. Elisa Kanowitz is a flu vaccine advocate and one of the founders and board members of Families Fighting Flu. Michelle Slevkowski is the Advocacy and Outreach Director at Families Fighting Flu. And Esterline Finord is a mom and one of my colleagues here at the partnership. Esterline is a Community Volunteer Partnership Specialist with the Unity Family Success Center. So welcome to our panelists today. We're going to have a great conversation. And Elisa, could you start by telling us about Families Fighting Flu? Oh, you have to unmute, Elisa. There you go.
Thanks, Emily. Families Fighting Flu is a nonprofit organization that consists of families who've been personally impacted by the flu. We know just how serious influenza can be, since our children have either been hospitalized or died from this serious disease. Our mission is to raise awareness of the risks of influenza and the importance of vaccination, since it's the single most effective way to prevent the flu.
Thank you, Elisa. Such important work happening at Families Fighting Flu as a national nonprofit. Michelle, pregnancy is a time when you are bombarded with information. So you're getting information about what to eat, what to put in your body, how to exercise. You're constantly going for doctor's visits. It can be difficult to keep track of all of the things that you're supposed to do. So why should expectant parents prioritize getting vaccinated for whooping cough and flu?
Well, as a parent, Emily, it's very important that we take care of our children. And in order to take good care of our unborn child, to get the vaccine for ourselves as an expectant mom will help take care of protecting our unborn child and also then protect them after birth until they're eligible to receive their immunization, regular immunizations. But the whooping cough and the flu vaccine will do extreme good work to protecting your child prior to and after birth.
Absolutely. Pregnancy is such a great opportunity to, this is really the first gift you can give to your child, right? Because what you put in your body goes to your baby, and vaccines, help to protect your baby before they're even born. So that's a great point, Michelle. Esterline, you recently gave birth to your second child, a beautiful daughter. Congratulations.
Thank you.
Why did you get vaccinated for whooping cough and flu during your pregnancy?
Yeah, so the reason why I got vaccinated for whooping cough and flu during my pregnancy is because I wanted to give myself the best chances at being healthy. I know that, with a newborn baby, that their immune system isn't fully developed. So they rely on me as the mom to make the best choice for them and for their health, and to make sure that, they have the best chance, especially when they first come out as, these beautiful babies.
That's great. It's such an important, there's so many important decisions that you make as a parent. And this is a really great decision to make when you're, pregnant and visiting your doctor. So that's great that you decided
Absolutely.
to do that. In your role at the partnership, Esterline, you talk with families every day at our Unity Family Success Center. What do you tell them, or what information do you share with those families about vaccines?
Yeah, so like you mentioned, I do talk to families a lot about vaccinations, and a lot of the conversations I have are centered around debunking these myths that we hear about vaccines. So when I talk to these families, I try to reassure them that, one, vaccines are safe. for you, for your baby, for your family. I also talk about how vaccines are effective and how there's benefits for vaccinations for the mom as well, not just the baby. And I try to give the family support because I once was, a family that didn't have all the information, or, with the, the era that we're in now with social media and a lot of misinformation. I try my best to give accurate information so they can make the best informed decision for themselves as well as their babies.
That's great. It's so important to have somewhere where you can go, and whether it's a virtual space online, a Zoom meeting or a workshop like that, or in person, so it's to go to a health fair, or walk into the Family Success Center and talk with somebody that can share information about vaccines and get your questions answered, and also to be able to talk with your healthcare provider, your OBGYN or your midwife during pregnancy, to be able to bring up questions about vaccines and how you can best protect yourself and your child. So Elisa, we're in a time where there's a lot of misinformation about health. As Sterling just mentioned, social media, which is a great way to share information, but also, we know there's a lot of misinformation out there, especially around vaccines. So why should pregnant people get vaccinated during pregnancy? Can you help us to set the record straight?
Sure. There are two reasons why pregnant women should get vaccinated during pregnancy. First of all, during pregnancy, pregnant women's immune systems are a little wacky and often tend to overreact to everyday viruses, especially for flu. So we see a lot of complications that happen among the pregnant audience. So it's very, very important to protect yourself and your baby during the pregnancy. And then after the baby is born, your baby will have antibodies. So your baby actually benefits from you getting the vaccine while you're pregnant. Unfortunately, babies cannot get vaccinated until they're 6 months old. So that is such a vulnerable time for our little ones. So it's so important that they have these antibodies and they have this protection. So you're really just setting them up to go out into the world and protecting them.
Absolutely. We're going to come up on another flu season right around the corner this fall. Flu season usually starts in October and can last through May, as it did this past year. We saw flu cases, especially pediatric flu cases, well into May here in New Jersey, and I think nationally as well. So, it's so important to get that protection ahead of time. And like you said, Elisa, we don't immunize infants for flu until they're 6 months of age, and we don't immunize infants for whooping cough until they're 2 months of age. So up until that time, they're really relying on their moms having been vaccinated during pregnancy to give them that protection. So it's so important that, we can do our best to vaccinate our children when they're here, but we also need to take this step before they get here, while we're pregnant. Michelle, we have an exciting project to share today about maternal vaccination. So could you share some information about our new video series?
Sure. We're very excited about this video series. This video series will be used with Families Fighting Flu's marketing and communications on a national level to help educate parents and new moms to be on how important these two vaccines are. These videos are coming from information of reliable resources, other moms who've received the vaccines when they were pregnant, other healthcare providers that are going to share the stories as to why the importance of these vaccines during pregnancy will help protect not only the mom, but the baby. And we're really excited. We're actually going to be sharing these videos on a national level. We'll be sharing these videos in some OBGYN offices, We've got targeted states that we really want to help educate, especially in communities where people may not be familiar with these vaccines and how important they are for a newborn or an unborn and newborn child to have through their mom. And we're just really excited. We're going to share these videos and start collaborating with PMCH to get these out here soon and in the doctor's offices by October.
Right in time for flu season to help booster all of the good information that's out there about flu and whooping cough vaccines, right? As we head into, winter, when especially respiratory viruses, do tend to have an uptick, or at least traditionally they did before the pandemic. Now our viral seasons are all kind of mixed up now. But we typically know that going into winter is a higher risk time for contracting respiratory viruses. So, it's great we have, just to piggyback off of what Michelle was talking about with the videos. So we did have 4 moms participate in sharing their stories, including Esterline. And Esterline, I wanted to ask you, you're featured in one of these videos that we're launching. And could you tell us, why did you decide to participate? Why did you agree to participate in this series to tell your story?
Yes, so I agreed to participate, and I was excited to participate because I want to be part of that change. I remember me, myself, as a mom, when I had my first son, I had no idea about, vaccinations. I had my own worries, my own fears, along with the other anxieties that, a pregnant mom experiences. And it was through the information that I learned. It was through talking to providers, talking to people that had educated information that they can give me. And I want to be a part of that change by motivating, inspiring, or just telling a mom hey, I was there once before and I made the best choice for myself. I made the best choice for my baby. And hopefully that can, help a mom make that more informed decision for the health of herself, her baby, and for those that love them.
That's great. That's so important, Esterline. I appreciate you, participating in this series. And I think you are going to inspire a lot of people and help people to make an informed decision about getting vaccinated during pregnancy. We've talked about, there's so many different places that we go for information about vaccines. And I think there's a lot of conceptions about vaccines during pregnancy. So it's so important to elevate the stories of people who, did the research. They talked with their doctor, they talked with their family, they talked with trusted medical professionals, and they decided to make that decision. I know for myself, I got vaccinated during my pregnancies as well, for both flu and whooping cough to protect my children. And I think it's important that everybody has access to information like this. Michelle, I know that you or Elisa might be the better person to answer this, but how does Families Fighting Flu help to share information about flu vaccine in general throughout the year?
There's many ways we do that. We do it through social media channels. We do it through boots on the ground, peer-to-peer communications and advocacy. But most importantly, we utilize our family stories. Like Elisa's, as a founder, she has her story regarding her daughter, Amanda, and how her family was impacted by flu. And therefore, we use these stories as these videos. We'll be sharing stories from moms like Esterline to help people understand the seriousness of flu and how they can best protect not only themselves, but their families and their communities around them, with the best prevention being to vaccinate against flu as well as other diseases. But we do this with a lot of our peers, peer-to-peer reliable sources, sharing their experiences, their stories, and getting the word out there. Elisa, would you like to add to that?
Well, what we have found is that when people hear numbers and statistics, it seems like it's somebody else. It could never happen to me. And we're here to put a face on the flu and other vaccine preventable diseases and let people know that unfortunately, if it could happen to us, it can happen to anybody. So do everything you can to protect your family. And a vaccine is such a simple and powerful thing that you can do to protect your family.
Absolutely. Thank you, Michelle and Elisa. I think that, if people are looking ahead to flu season, we also have at the partnership the Power to Protect New Jersey campaign as well. So that can be a resource for where to go to get a flu vaccine. And then nationally, you can use the CDC flu vaccine finder tool, or I think Families Fighting Flu as well. Their website has a great tool as well to locate where to get vaccinated. And whooping cough vaccines are available at doctor's offices or retail pharmacies. They're really widely available, and it's called the Tdap vaccine that you would get during pregnancy. So these are, this is the basis for this project, 2 Protects 2. The whooping cough and flu vaccines protect both mom and baby from very serious illnesses. And it's something simple you can do, like you said, Elisa, to protect yourself and your family. So I'd like to, we're coming up to time. I'd like to thank our panel today for participating in this conversation. And I'd also like to take a moment to acknowledge and thank all of the people that were involved in making these videos and bringing this series to light. So Dr. Tia Welsh from Valley Health, Dr. Aguirre from Jersey City Medical Center, as well as our moms that are featured, Esterline, Kara, Casey, and Jalissa, all did a great job of sharing their stories and sharing why it is important for moms to get vaccinated and to take this step during pregnancy. And if you would like to learn more about this campaign and these resources, we encourage you to share these videos. They're up on the partnership's website. They'll be available on Families Fighting Flu website under the resource library. And they're on YouTube as a YouTube channel playlist. So they're going to be widely available. We encourage you to use them to help spread the word and awareness about maternal vaccinations. You can find them at pmch.org/2protects2 and also on our YouTube channel. Michelle, can you guide people to the Families Fighting Flu website as well?
They'll be able to find the video resources as well as any supporting resources in print on Families Fighting Flu's website, which is www.familiesfightingflu.org. And they write to our resources.
Thank you, Michelle. And you mentioned something that I happen to have with me here. It's the one of the postcards that goes along with this campaign. And so we have these postcards available in English and Spanish. We have some bookmarks and also some 8.5 by 11 flyers that can be used, at doctor's offices or community-based organizations, pharmacies, to help give some information and education about vaccines during pregnancy. So you can order those from our website as well to distribute. So I'd like to thank everyone so much for joining us today. Thank our audience for tuning in. And thank you, Michelle, Esterline, and Elisa for joining us today.
Thank you.
Thank you very much.
Thank you.
Bye.
Hey.